Hi, we're just going to thank you all for coming. We're just going to wait another minute or so, let the room fill up a little bit, and then we'll go ahead and get started. Okay, great. Here, we're going to go ahead and start. Good afternoon, and thank you for joining us. My name's Dave Wallach. I'm the Executive Director, and on behalf of Americans for Responsible Growth, which is a national advocacy group that works with state and local financial leaders, treasurers, comptrollers, auditors, who see firsthand how federal policies impact communities. Today, we're here to push back on President Trump and Elon Musk's cuts to life-saving programs that the American people depend on, and the federal funding freeze that set off mass panic and put federal grants for medical nonprofits, Medicaid payments, and funding for hospitals on the chopping block. Our speakers today are Treasurer Elizabeth Steiner from Oregon, Treasurer Laura Montoya from New Mexico, Treasurer Dave Young from Colorado, and I believe we'll also have Treasurer Colleen Davis from Delaware joining us shortly. So, with that, as we begin, I want to note that we're recording this call. We're going to share it out afterwards, and at the end, we'll have some time for questions and answers. So with that, I'm going to go ahead and pass it to Treasurer Dave Young of Colorado. Treasurer Young.
Thank you, Dave, and I appreciate it, everybody joining us today. I am the Colorado State Treasurer, Dave Young. And today I'm proud to join my colleagues and speak out against the potential Medicaid cuts that we're seeing coming from the Trump administration and from the activities of Elon Musk. As treasurers, we're charged with keeping our tax dollars safe and planning for a strong financial future. That mission depends on providing quality health care for all Americans. When people lack the right coverage, they seek treatment in emergency rooms. And this creates a massive tax burden on local communities and states. Treating needed care, but not care that's needed in the emergency room, is a really ineffective way to promote good health care and doesn't result in good outcomes. And so these cuts actually go the wrong way if you're trying to have a healthy families and healthy communities. The Republicans' current budget plan, backed by President Trump, is not only financially reckless, but it's needlessly cruel. In Colorado alone, we have about 1.2 million seniors, disabled people, pregnant mothers, working class families that depend on Medicaid. If federal cuts go through, our state must make up the difference by slashing other essential programs like education or kicking thousands of Coloradans off Medicaid. Neither option is acceptable to me. That's why we must do everything we can to protect Medicaid. We must do better and be more thoughtful in this effort. This is not just a political fight. For me, it's a personal one. My sister Dorothy is intellectually developmentally disabled. She also has mental health, behavioral health issues, and now pretty significant physical health issues as well. And for an entire lifetime, our family has worked to try to provide care for her, but her needs are so tremendous. The ability for us to deliver life-sustaining care for her far outstrips our abilities. Even if we quit our jobs, we just don't have the capacity to do this. And this is why we are so appreciative of what Medicaid provides, because it's allowed her through almost 69 years of life to have life-sustaining care. And without this critical resource, we would really struggle. And I know this for a fact because about 25 years ago, Medicaid did not have enough money in the state of Colorado. And for a period of maybe approaching a year and a half, from 1999 through 2001, about maybe 15, 18 months, She went through 20 residential placements. She was essentially homeless for over that period of time. This is somebody who has no ability to care for herself in the community, but was out on the street because Medicaid didn't have enough money to support her. And so, as you can imagine, our family was just totally in crisis on a daily basis. I discovered that there were hundreds of families and maybe thousands in the state of Colorado experiencing the same kind of frustration, the daily grind, these problems of just trying to keep loved ones safe and protected and cared for. And so I ran for office to advocate not only for my sister, but for the thousands like her, and because I've seen how essential these services are and how fragile our Medicaid system can be if we don't protect it. So now is not the time to cut Medicaid. It's going to throw all kinds of people into crisis across the state of Colorado and the country. But we can actually make smart reforms, and we can streamline delivery of care while reimbursing providers at the rate they deserve. So I'll not stand by while President Trump and his Republican allies gut essential services under the guise of efficiency. These are just convenient political buzzwords and not based in any kind of reality in our community. We know that Medicaid coverage makes care accessible, improves long-term outcomes, and staves off medical debt. It also improves the quality of life and stimulates the economy. It makes America healthy. The stakes are too high to sit this one out. We need a vocal, united, and bipartisan coalition to defend Medicaid. I urge President Trump and the Republicans to take these cuts off the table and preserve these vital benefits for millions of Americans. Thank you.
Thank you, Treasurer Young. Now I'll have Treasurer Montoya from New Mexico. Treasurer Montoya, the floor is yours.
Buenos dias. Good morning, everyone. I want to thank my fellow public servants for continuing to discuss the harmful impacts this administration is having on our states and our economy. Thank you to Treasurer Young for sharing his own personal story with his family, because that story is a similar story for all Americans that are going through something in crisis with what is going on with these Medicaid cuts. The results of President Trump's and congressional MAGA Republicans' federal funding freeze will lead to cuts in Medicaid, life-saving programs, federal grants for medical nonprofits, and funding for hospitals, all to subsidize Musk and people who have loaded pockets just like him. Their malicious intent will have catastrophic consequences for the vulnerable New Mexicans and Americans across this country. And when we say that, I mean our newborns, our pregnant mothers, our veterans, our people with disabilities, our retirees, our firefighters, our cops, our teachers, and our elderly. The recently passed federal budget resolution, which will cut $880 billion from the U.S. House Energy and Commerce Committee over the next 10 years, would be impossible to carry out without shattering Medicaid or Medicare. Medicaid and Medicare are the largest payers of healthcare in the nation. If the federal government slashes funding, hospitals, doctors' offices, and clinics that depend on these funds will be forced to either raise premiums and co-pays for patients or shut down altogether. New Mexico is the nation's largest recipient state for Medicaid assistance, with the federal government paying 72% of the cost of traditional Medicaid. Nearly 33% of New Mexicans rely on Medicaid or CHIP, Children's Health Insurance Program. Nearly 80% of our babies are born in New Mexico, are born into Medicaid. Data shows that the first 3 years of a child's life are the most consequential for healthy growth and development. These cuts mean doctors and healthcare facilities will not have the capacity or funding they need to provide access to critical milestone appointments for children. Long-term, cutting Medicaid will mean steeper birth rate decline, which, when New Mexico and the country are already facing significant issues relating or resulting from declining fertility rates, such as an aging population and smaller and weaker workforce, resulting in lower tax revenues. 80% of counties, including those in New Mexico, are considered healthcare deserts. We all know how difficult it is for our families to get to a doctor or receive specialty care. That is unacceptable. New Mexico is proud to be ranked number 13 in the nation for the highest rate of veterans per capita, with over 120,000 veterans calling New Mexico home. Any cuts to Medicaid will be detrimental to people with disabilities, especially those who have sacrificed their well-being to valiantly serve our country. In addition, small businesses who provide health insurance for their employees will also be forced to pay more for their employees' benefits if they can continue providing insurance at all or keeping their doors opened. This leads to pressure on businesses to divert resources away from growth and innovation, forcing higher premiums, passing that higher cost on to consumers. If you think that this only affects people on Medicaid, you are highly mistaken. The negative impacts are already beginning to manifest in areas beyond Medicaid, as New Mexico tribal communities and organizations serving underprivileged populations are experiencing severe operational and staffing blows. In a harrowing example, Albuquerque, New Mexico's biggest city, is at risk of losing almost $200 million in federal funding. Local leaders across the state are already bracing for the wide range of harmful implications these cuts will have on our communities, which places shelters, affordable housing programs, and public safety at risk. If you have not asked yourself, why are these cuts being forced down our throats? It is to fund the Trump 2017 Tax Cuts and Jobs Act, which in simple terms funnels tax dollars from hardworking families to deepen the pockets of the wealthy. They are using the threat of a government shutdown as a manipulative tactic, holding essential services hostage for political gain and undermining our government's role in serving the public. This is reckless and harmful to our communities. We should never be forced to choose between a roof over our head, food to sustain ourselves, or life-saving medication to live. Polling has shown that 44% of New Mexicans did not fill their prescription or skipped taking medications altogether due to the cost concerns. The effect of bad policy, despite who's being targeted, does not discriminate. Even the wealthiest people still rely on the labor of the working class to maintain their lifestyles. Trump is devaluing and underestimating the strength of the middle and the low-income communities. We take care of your babies and elderly. We take care of your children and teach them. We construct your homes. We farm or make your food. We build your businesses, and we make this country strong. This is another example of the complete disregard for Americans that characterizes Trump's administration, including his unelected and unappointed sidekick, Elon Musk, and all those MAGA congressional Republicans pushing this policy in Congress. We have the largest economy in the world, but our healthcare system ranks 38th when healthcare is considered across the globe to be a fundamental human right. The irony of making cuts to Medicaid is that the very lawmakers elected to serve Americans' best interest are the ones who grant themselves access to top-tier comprehensive health coverage most Americans can only dream of. People power is strong, and together we can assure that American policies are in America's best interest. So I'm asking all Americans, know your power. Call your U.S. senators and representatives and demand that they prioritize the best interest of all Americans. And I'm calling on President Trump and the congressional MAGA Republicans. Do the right thing. Stop dismantling this country. Stop undermining vital programs like Medicaid. Stop cutting and freezing funding that American families and communities rely on, and stop creating fear and chaos. And instead, how about you do your job? Do your job and prioritize the well-being and stability of our nation. That's all I have, Dave. Thanks.
Okay. Thank you, Treasurer Montoya. Okay, now we're going to close up with Treasurer Elizabeth Steiner from Oregon. Treasurer Steiner. Treasurer Steiner, you're muted.
Thank you. You'd think after all this time I would have learned to unmute myself. As Oregon State Treasurer and a family physician, I'm here to talk about the devastating impact that cuts to Medicaid would have on working families in Oregon and around the nation. Republican congressional leaders want to slash as much as $880 billion from Medicaid to pay for tax cuts that will primarily benefit corporations and well-off people who already enjoy the best possible access to healthcare, as Treasurer Montoya just said. They're considering a range of proposals that would gut federal Medicaid funding to states or erect bureaucratic barriers like work requirements and frequent eligibility reviews, which are solely intended to deter people from obtaining and keeping benefits by entangling them in red tape. Where, I ask, is the efficiency in that? Let's be clear, none of this needs to happen. All of these proposals to cut Medicaid will deny people health care just so wealthy people and corporations get tax cuts. This action is not congruent with our nation's values and will harm Oregon's and the nation's economy. So how do I know this? I'm a family physician who's treated patients, including many on Medicaid, for decades. In addition, I served in the Oregon State Senate, where I chaired committees that established innovative and effective health reforms, including Medicaid expansion and the state's basic health program, which covers people with incomes up to twice the federal poverty level. I've seen how Oregon's Medicaid program has expanded health coverage, slowed the growth of healthcare costs, and produced better health outcomes in our state. Good health is necessary for financial well-being. You cannot work and be fully productive if you're not healthy. And let me be clear, most people on Medicaid, or at least most adults on Medicaid in the United States, work. Work requirements would not actually change much except to add paperwork. In turn, you cannot be healthy if you're burdened by unaffordable health costs and medical debt, or if your job prospects are limited by the need to care for an elderly or disabled family member, as Treasurer Young alluded to in his compelling story. Medicaid budget cuts under consideration by Congress could cost Oregon more than $3 billion, $3 billion with a B, in federal funding and put coverage at risk for more than 670,000 Oregonians. At a time when people are feeling the strain of rising costs and financial uncertainty, our nation cannot afford the economic and health effect cuts to Medicaid. Today, many families feel like they're in a financially precarious position. According to a financial wellness survey my office recently published, 1 in 2 Oregon families do not have the means to set aside $500 for an emergency, much less pay for insurance and healthcare out of pocket. Medicaid cuts will delay or deny healthcare, raise costs, and push more families closer to financial instability and bankruptcy. In our state, working and disabled people on Medicaid are paying close attention to congressional proposals that could upend their care and their lives. They know the stakes and they're expressing their alarm. Whether it's a person worrying how they will have access to life-saving medication if they lose coverage, as Treasurer Montoya mentioned, or a disabled person living with the fear of becoming homebound without coverage to pay for the wheelchair that provides mobility and independence. Medicaid enables families and communities to thrive physically, mentally, and economically. And I would point out that that is especially true in rural and frontier counties facing the greatest barriers in access to healthcare. Let's look at some of the numbers. In Oregon, Medicaid serves 1 in 3 people. And today in Oregon, thanks to Medicaid expansion, 97% of Oregonians have health insurance coverage, the highest level in state history. But before Oregon expanded Medicaid, nearly 20% of Oregonians lacked health coverage. 57% of Oregon children are covered by Medicaid, and like so many other states, more than 4 in 10 births are families on Medicaid. 2 out of every 3 nursing home residents, 2 out of every 3 of our senior citizens who deserve the utmost respect and dignity rely on Medicaid. And I would point out here that counties in rural areas typically have Oregon's highest Medicaid enrollment rates. In Oregon Congressional District 2, which spans most of Oregon east of the Cascades, about 2/3 of the land area of our state, and is the only Oregon district represented by a Republican, it's more than 40% instead of 33% of residents get health care through Medicaid, which is the highest percentage of any area in the state. And it's 70% of children who are covered by Medicaid, and more than 110,000 adults are covered by Medicaid expansion, which is a target of Republican budget writers. Oregon's economic stability is also at risk. Medicaid budget cuts or cost shifts to states will eliminate jobs, hamstring our economy, and destabilize the healthcare system, especially in rural communities like those across Eastern Oregon. According to an economic analysis, Medicaid expansion in Oregon created 23,000 jobs in communities across the state. Excuse me, and it generates more than $1.5 billion in associated economic activity beyond direct healthcare expenditures for the state's economy. Medicaid cuts would destabilize hospitals, especially in rural communities. The ratings agency Fitch noted that the weak state of hospitals and said a decrease in Medicaid reimbursement would hinder hospitals' nascent financial recovery. Ratings agencies like Fitch and Moody's have also raised concerns about massive cost burdens that federal Medicaid cuts would impose on state budgets and the credit implications of those state budget strains. Higher borrowing costs for states would cascade throughout the economy, eliminating construction and other jobs and raising taxpayer costs. Yet, by any measure, Medicaid is a bargain in the benefits it provides. Nationally, 97% of Medicaid payments go to providers. Only 3% pay for administration. That is way better than commercial insurance. And in Oregon, Medicaid costs have grown more slowly than those in Medicare and the commercial market. Oregon's unique Medicaid program has reduced unnecessary emergency department visits, improved vaccination rates, and connected more people to mental health and substance use treatment. The bottom line, Medicaid works. In Oregon, it has helped slow the growth of health costs while simultaneously providing vital health coverage and senior care that many families can't afford to live without. America needs to provide opportunity to working families who are already struggling to save for emergency, their children's education, and retirement, not put greater financial burdens on their shoulders. Protecting Medicaid is a vital investment in the well-being of hardworking and middle-class and working-class families. I urge Congress to put the interests of working families ahead of another tax cut benefiting the wealthiest Americans and corporations. Thank you.
Thank you, Treasurer Steiner. Now we're going to take some questions. If you have questions, please put them into the question and answer button at the bottom of your screen in Zoom, and we'll take a couple of them. We're going to start out with the first question. Treasurers, you can decide who wants to take it. It's how would Medicaid cuts affect rural hospitals, healthcare employment, and state economic stability in your regions?
I'm happy to start.
Go ahead,
so
Treasurer.
Go ahead, Treasurer. Okay. I'm happy to start, but I'm sure that my colleagues, all three of us, have large rural areas in our states, and I think we can speak to this really well. Rural hospitals are already struggling, and we have seen closures or limitation of services, in particular maternity care, across the rural parts of our state in these what are called critical access hospitals. These hospitals, because a high percentage of the patients that they serve are on Medicaid, if these patients no longer have healthcare coverage, and let's just be crystal clear about this, the people who are cut from Medicaid will not suddenly turn around and be able to purchase health insurance on the exchange, because that is not something they can afford. So I want to be clear that no Medicaid means no insurance at all for the vast majority of people, or minimal health insurance through employers that's expensive and has very high deductibles and keeps people from seeking care. So the hospitals that are already struggling will lose even more funding, and I suspect that a significant percentage of them would go under without this funding, leaving many, many people across Oregon and across the nation having to drive hours and hours for critical health care, in particular maternity care, emergency cardiac care, strokes, the kinds of things that are truly time sensitive.
Well, I couldn't have said it any better. It's clear because of the fact that Treasurer Steiner is a physician, that she understands this very deeply. I'll just say it's not strictly a rural problem. You get any hospital, I think about Denver Health in the middle of downtown Denver, is straining under overuse of the emergency department as well. What we've seen in rural Colorado is the fact that they can't pencil out uncompensated care. And eventually, what I worry happens is that we're going to end up having rural hospitals close their emergency departments because they just can't sustain them. And that may leave people driving hours in an emergency to seek emergency care. This is just an equation that doesn't pencil out. And as Treasurer Montoya said, this is just to give millionaires and billionaires a more tax break. When you put this kind of load on communities, is not a good balance. We seek a better balance here so that we can actually make sure people seek care in the most appropriate place, not in the emergency room.
Well, I think the other factor of that is you negatively impact emergency room care because then people don't have the coverage that they need in the areas that they need it. So in New Mexico, we only have 2.1 million people. Our biggest city is Albuquerque, that's about 560,000 people. So most of my state is very rural. So a lot of our tribal communities, a lot of our rural areas, they hardly have any access to medical care at this point. It's only going to exacerbate the problem. We already have a lack of physicians, and now it's making it more challenging. Sometimes people need to wait a whole year just for a doctor's appointment. So now that this happens, it's going to cause more strain on everyone and everything. And so I think it's very unfair to keep on trying to do things to make the rich richer and make the poor, the middle class poorer. And everyone knows in economics, if you don't have a middle class, your community and your economy fall.
Great, thank you, treasurers, all of you. For our next question, we're going to take a question from Cameron Dean. Are there state programs that can act as a safety bank for those who are denied or cut from Medicaid? Are people still being accepted in Colorado? What are your options? And I think you all maybe have something to say about this beyond Colorado. But
well, I'll jump in since it's coming. Yeah, it's coming from one of our great reporters here in Colorado, and the answer is that Medicaid is that safety valve for people. It is the option of last resort. So when you decimate that, you have nothing that's available. And I think this is really the concern of our hospitals, whether they be in rural Colorado or even in urban areas, and that is that people can't get appropriate primary care, preventive care. They end up on maybe some high deductible insurance plan that they really can't afford anyway, and so they don't access health care at all because they can't pay the deductible. And so these problems become bigger and bigger and bigger until they are emergency, and then the cost of care is exorbitant. Preventive care, good primary care is the best way to do this. And when we expanded Medicaid to include the expansion population, we promoted better care for people so that we could actually get better health outcomes and save money. So by going the opposite direction, you go in the direction of poor healthcare outcomes for people and higher costs. I don't know in what universe that makes sense. It doesn't make sense in my universe.
I would add for our New Mexico press just to look up Senate Bill 88. It's on the governor's desk. Our legislature's been very proactive. We just finished our legislative session on Saturday, and Senate Bill 88 is to help with a Medicaid trust fund in order to help subsidize whatever ends up happening with the federal government. But I really like John Daly's question. So Dave, I definitely want to touch base on that after you read it.
I would just add really quickly a very fast story that illustrates well the downstream effects of Medicaid cuts. Prior to the Affordable Care Act and Medicaid expansion, I used to volunteer at a safety net clinic for people with no health insurance as a physician. One day I had a man who's about 43 come in to see me because he was an avid soccer player and he was starting to get short of breath. Now, this man had a family with 5 kids, whom he supported by working 60 to 70 hours a week at least as a cab driver, working very hard, supporting his family and managing to do that. Kids were in school, all the things that we really want. And he didn't have health insurance. Well, what we discovered, because we were able to get him a free ultrasound of his heart, once I found the heart murmur, is that he had significant heart valve issues that would eventually lead to his death. The surgery to fix that would have cost him about $100,000 at that point. which was not something that he could afford. And yet, if this problem didn't get attended to in a timely fashion, he could have sudden cardiac death from this problem, leaving his widow and his 5 children without their only source of financial support, and thus turning them from a family that was independent and financially stable, if not truly secure, to a family entirely dependent on public resources to help them through this. With Medicaid expansion, with the fact that Oregon now has 97% coverage, a person like that would have easy access to life-saving surgery that would help keep his family stable and help his children thrive. This is the kind of thing that we will see over and over and over again, whether it's rural or urban, if we see the Medicaid cuts that this administration is proposing.
Great. Here, Treasurer Davis from Delaware has joined us, so she's going to make her statement, and then we're going to get back. I know there's a few more questions in the queue. So with that, Treasurer Davis, you take the floor.
Yeah, thank you so much. I just sort of speaking from the experience that myself and others have had. I think there's a substantial challenge that folks faced quite some time ago regarding the concept of pre-existing conditions, which we were able to overcome for so many, and yet we're facing the same challenges. For example, someone who's been diagnosed in their 20s with a long-standing condition, they're unable to access expensive medications that help to keep their disease from flaring up. One example I think about is a constituent that I have that has multiple sclerosis, very expensive medications to keep them stable. However, they're functional. They're able to go to work every day until their medication became more difficult to pay for and to access. As a result, that individual had blindness, sustained blindness related to their condition. That has not recovered, even though they got back on their medication. So this individual went from a functioning person who had the capability to work and to produce and be part of the economy, and is no longer able to do that, is no longer able to even care for themselves in the same way that they could, all because we made it difficult for them to obtain one medication. And that's all it takes to change not only one person's life, but it's all it takes to have a true impact on the economy and the way in which we ensure people are thriving every day. It's a shame.
Thank you, Treasurer Davis. We're going to jump back into the questions now. So we'll start off with John Daly's question, which I'll read. Can you respond to Republicans who have said in pursuing these cuts, things like this, we know that there is fraud, waste, and abuse in the system that we have to be able to find so that we can actually save Medicaid for the vulnerable populations who need it most? So go ahead.
I call baloney, to use a word I can use in a public press conference. I call baloney. You know, every single state in the nation had to go through an entire redetermination process for every single person on Medicaid after the pandemic. We went through redetermination in Oregon for 1.4 million people. And what did we do? We determined their eligibility by examining their tax returns. Where did we get those tax returns? From the IRS, because we are allowed to do that in an agreement with the IRS so that we get their tax returns so we can, in fact, determine whether they are financially eligible for Medicaid. So the idea, and every single state in the union had to go through this redetermination process. There was plenty of media coverage of it during that time. And the idea that all these people are on Medicaid fraudulently is not backed up by the actual data. Now, are there some tiny percentage of providers who may do some inappropriate things? Yes, but Cutting $880 billion from Medicaid will do nothing to root out those providers. It will only hurt the people who are legitimately covered by Medicaid based on their financial position. And that financial position, that financial eligibility is determined primarily by federal tax return data.
So I think for me, so that's gaslighting. I don't know if everyone understands that term in the world, but my young staff have taught me very well what that is. So let me beat you up and then let me give you some roses and act like I saved your life from what I actually caused the problems to be. And anyone who is a legislator or a congressional person that says something like that, I hope somebody writes to their constituents and lets them know what they've said. And I also hope that at the same time, all of the Congress folks see how many people on Medicaid are in their district, and I hope they get them out of there because they're not serving the American people. The other thing I would say is this type of chaos and stress is exactly why our increase from 75 to 90% of all doctor's office appointments have some type of stress-related connectivity to them. This type of negativity is careless. If we're going to talk about fraud, waste, and abuse, which every agency has an audit done every year and you can correct things, then you have to ask yourself, what are they defrauding? Somebody who has cerebral palsy, what are you going to get? Extra AFOs? I mean, what are we defrauding if we're on Medicaid? The other part is if we're going to look at that mindset, fraud, waste, and abuse, why don't we look at it of all the tax write-offs? And how about we look at it from the perspective of not allowing people to have any tax breaks till we figure it out to see who's doing it the right way? We should start there.
Well, and I think all of those comments are excellent. I agree with Treasurer Steiner. You know, the first couple of words, we know. Well, I think that's a convenient catchphrase or buzz phrase, but it's not true. You don't know. We've shown that, in fact, that it's a very lean system, particularly in Colorado. We have to be very careful because of the budget restrictions that we have under Tabor, and we have to be very careful about who's utilizing services. And so I will say that at a federal level, giving Centers for Medicare, Medicaid and Medicare services, got that backwards, Medicare and Medicaid services, the ability to negotiate drug prices is a real huge cost savings. And we haven't been doing that. We're beginning to do that now, but we need to do more of that. We pay multiples of what other countries pay for the same medications. And this is why we have more expensive health care and have lower, have higher death rates and less competent or less effective health care, because we've allowed ourselves to get trapped into a system that where fraud and abuse occurs, but not here in Medicaid, but at a greater level. And so we are worried about the impact on individuals across the state and the country. And I'm going to say that we can actually do things to make the programs more effective, get better outcomes, and save money. But the way to pursue those things is not by trashing the system. And that's what's going on right now. Turning people out on the street just to see what will happen is just a cruel and ruthless approach to trying to find where the problems are and fix them. That's not a solution package or pathway. That's just creating a massive problem for thousands and thousands of people in every community. Not effective. It's just ruthless.
And using their money to do it. I think the waste, fraud, and abuse thing, it really pisses me off just because you're looking at Doge, you're getting a Tesla. I mean, how does that make any sense on waste, fraud, and abuse? Start in the president's office right now and this excuse of an organization called Doge and see what waste, fraud, and abuse is occurring there before you go and hit the most vulnerable people using their tax dollars to impact them in a negative way. It's a joke.
Great. So we're going to take one more question and then close this up. So treasurers, how much funding will be lost and what can be done by voters who want to turn this around or prevent these cuts from happening?
Well, I'll jump in real quick, because apparently I'm getting everybody ramped up here in Colorado. These questions are coming from our Colorado reporters. Colorado is unique because we have a provision in our Constitution, the Taxpayer Bill of Rights, that actually puts the burden on voters to make tax decisions. And that's a little different than what you see in many states. Some states approach it, but Colorado has the most restrictive tax and expenditure provisions of any state in the country, and it's embedded in our Colorado Constitution, which means the voters have to make these changes, and it's very difficult to actually work through that kind of a process when the legislature isn't empowered to be more nimble and try to deal with it. So in Colorado, about a third of our budget is the overall budget is dedicated to Medicaid. And so, that's a sizable amount of the budget, and as costs for healthcare increase through these other factors, somehow we have to deliver care. It's going to crowd out other parts of the budget. We already have the lowest competitive salaries for teachers in the country. Colorado does. We think of ourselves as a very progressive and an economy that's robust, but we have the lowest competitive salaries for teachers in the country. And as these healthcare costs increase, it's just going to crowd out our education expenditures even more. And these are just not sustainable pathways for delivering effective services for people in the state of Colorado that we know need them. Children need to have a quality education. People need to have effective health care. We want an infrastructure system that works for people. Our business communities count on that to thrive. And without a thoughtful approach to dealing with Medicaid, particularly in Colorado, we put the future of our state at grave risk.
Either of you want to jump in on this? Or?
Trying to unmute. I think the other thing I would say is this. I think Treasurer Montoya mentioned in her initial remarks that in many other countries, healthcare is considered a right. In Oregon, we passed in 2022 an amendment to our Constitution that says that healthcare is a right and that the state has a responsibility for ensuring that Oregonians have access to high quality, affordable healthcare, evidence-based affordable healthcare. If the federal budget cuts for Medicaid go through, Oregon is scheduled to lose about $3 billion. That's about 8% of our biennial general fund, lottery fund budget. This coming into this next biennium, 7 or 8%. And it is possible, although we would be hard pressed to do it without taking away from K-12 funding, from higher education funding, from public safety, from all sorts of other services, it is possible that we would have to backfill that $3 billion and make major cuts in other budgets that Oregonians depend on. So we would have parents who would lose healthcare coverage, get it back, but at the cost of having their child then in this first grade classroom with 35 or 40 kids in it, because the schools couldn't afford to have small class sizes. So I think we really have to understand that these cuts don't just affect Medicaid. They affect our economy, they affect our schools, they affect public safety, they affect so much more than just Medicaid, and they are harming the most vulnerable Americans just so wealthy people and corporations can get tax cuts. I find it unconscionable, frankly.
Okay, unless you want to have the last word, Treasurer Montoya, we're going to close this off. Okay, thank you everybody for joining us. We're going to be sharing out the video from this call after the call, and look forward to talking to you again sometime soon. And thank you, treasurers, for sticking with us for so long. Appreciate it.
You bet. Take care, everybody.
Give it to them, press.